Hello, I hope you're enjoying the wonderful webinar put on by Larry, Hanjo, Zeeshan, and Ron. I'm Bob Eastlack and wanted to take a few minutes to talk about histologic evidence of bone formation using MagnetOs bone graft. MagnetOs is a biphasic calcium phosphate with a submicron needle-like surface topography that is called needle grip. Thanks to that needle grip topography, which is proprietary, it can harness the immune system to stimulate bone growth without added cells or growth factors. And this has been shown in level 1 human clinical studies to achieve great fusion rates. Why is it different from every other bone graft? It's the topography. This needle grip technology allows for macrophages to polarize into the right direction, which is the M2 pathway you see on the right. This is a pro-healing pathway that stimulates cells to become bone-producing cells versus the M1 pro-inflammatory pathway that promotes fibroblast proliferation and ultimately scar tissue. MagnetOs was studied in a level 1 randomized clinical trial in a posterolateral fusion model in 91 patients. And these patients had MagnetOs placed on one side in a volume-controlled manner, and it was compared to autograft bone on the contralateral side from the iliac crest. And the fusion rates as a result of this CT assessment was 79% on the MagnetOs side and 47% on the autograft side. And this was further amplified and differential with smokers, in which case 74% of the patients had a fusion, while only 30% of those smokers had a fusion with autograft alone. One of the common questions that people pose is, how do we know that what we see on imaging is actually newly formed bone versus bone graft residual? The answer has been evaluated through several preclinical or animal studies, in which case histologic specimens were extracted after placement, as well as human instrumented posterolateral fusion models with biopsies taken and analyzed. There's also an ongoing data collection study doing the same analysis with biopsies. If we look at this histologic assessment of MagnetOs in a muscle pouch, without any added cells or bone growth factors, you can see here that MagnetOs on the top left, demonstrating black, which is bone graft material, fuchsia, which is the actual bone or what you see here, and then pink or purple, which is fibrous tissue, performs much better in that muscle pouch and actually forms bone even in the internal aspect of that growth bone graft material. And this is in distinction to the other materials here where you see essentially no bone growth at all in a muscle pouch. If you look at bone growth in a posterolateral fusion model over time compared to autograft, MagnetOs has bone growing within those granules in the center of the graft material between the transverse processes rather than simply propagating between the transverse processes or from them. And at 12 weeks, you see maturation of the same. And then at 26 weeks, very robust bone formation and density from TP to TP, somewhat similar to autograft, although more robust and dense. If you compare MagnetOs to the other graft materials previously discussed, you can see in that same transverse model that autograft is seen here, MagnetOs up here, and Vitos, Novabone, and the others really have a paucity of bone graft growing from TP to TP, and certainly very little bone graft within the center of the graft material. How does this look clinically? This is a 28-year-old female patient that underwent surgery by Dr. Todd Allen for scoliosis, and you can see scoliosis correction. MagnetOs putty was used solely on the patient's right intraoperatively, while the contralateral side underwent grafting with BMP2 and autograft and/or cancellous chips. At 2 years postoperatively, you can see a CT scan here showing robust bone formation with apposition to the transverse process, the spinous process, and lamina on both sides, including the MagnetOs side, really indiscernible on CT. And then histologically, upon extraction during the revision of a biopsy specimen, you can see very robust bone formation, both on hematoxylin and eosin staining, as well as trichome staining. And this is consistent with a very mature bony formation in this case based on biopsy. There are various indications and contraindications for the family of Kuros MagnetOs bone graft materials. And thank you very much for your time.